The question now is, assuming we're off the plateau and we're seeing a descent, which the numbers would suggest we're seeing a descent, the question is now, how long is the descent and how steep is the descent? And nobody knows. Just the way nobody knew how long the ascent was, nobody can tell you how long the descent is. And that's what we're trying to figure out. The number is coming down, but how fast does the number come down? Does it take 2 weeks for it to come down? Some projections say that. Does it take a month? Some projections say that. And again, the projections are nice, but I wouldn't bet the farm on them. And I don't even have a farm. Worst news is the number of lives lost. That number is still horrifically high. If you're looking for the optimist's view, it's not as bad as it was, but 478 New Yorkers died yesterday from this terrible virus. With reopening, I want to set the bar higher, meaning the question shouldn't be, when do we reopen? And what do we reopen? The question should be, let's use this situation, this crisis, this time, to actually learn the lessons, value from the reflection, and let's reimagine what we want society to be. And since we are going to have to go through all of this, and it's not going to be fast, let's at least make this a moment that when we look back, we can say, wow, we went through hell, but look at all the lessons we learned and look at how much better we made this place from this incident, right? In the meantime, do no harm, and this is my number one concern every day. Do no harm, don't let that infection rate go up, and that's testing, and that is watching the dial, right? We know what's going to happen now. The weather is going to warm, people are a little more relaxed because they see the numbers coming down, and we know human behavior. Activity level is going to increase naturally. When that activity level increases, you can very well see that infection rate spread. Infection rate is primarily a function of contact. You touch a surface and then I touch a surface. You cough and the droplets go on me. It's contact. And that's why places like New York City or anywhere you see a hotspot cluster, New Rochelle, it was about contact. People start coming out, they start moving around more, there will be more contact. That contact will increase the virus spread. Watch the dial, watch the virus contact spread. You'll see it in the hospitalization rate. To the extent we're doing testing, you'll see it in the testing rate. That's what we have to watch, and we will. And we have to watch this until we have a medical treatment or we have a vaccine. That's when this is really over. In the meantime, I say again to my local government officials, I'm getting a lot of calls from a lot of supervisors, town elected officials, et cetera. They're under increasing political pressure, and they're wanting to do things. The state rule is now everything is closed, and the state rule is they can't take any action that is contrary to that, because coordination and discipline is now key. So everything is closed unless we say otherwise. And the most important thing, I just had this conversation with a local official. Look, people need government to work. Government has to be smart. And if it looks confused between the state and the county or the state and the town, that's the wrong message for everyone. So let's just be smart. On testing and funding, those are the two areas that we're looking to work with our federal partners. Testing is going to require everyone to work together, federal and state and locals, by the way. We're starting the largest antibody test ever done today in New York, the largest sample. But this has to be a multi-level government coordinative project, because we have to do this on an ongoing basis. 40% of the frontline workers are people of color. 45% in public transit, 57% of the building workers, 40% of the healthcare workers. People of color are also disproportionately represented in delivery services and child care services, right? The economy closed down. The economy did not close down. It closed down for those people who, frankly, have the luxury of staying at home. All those essential workers who had to get up every morning to put food on the shelves and go to the hospitals to provide health care under extraordinary circumstances, and the police officer who had to go out to keep you safe, and the firefighter who still had to go out and fight the fire. Those people worked, and they went out there and they exposed themselves to the virus. 2/3 of those frontline workers are women. 1/3 come from low-income households. So they've been doing this work, they've been stressed, they're going home to a household, often had 2 wage earners. One of them is now not working, they're living just on that one salary. And after all of that, we see the infection rate among African American and brown Americans higher proportionately than other groups. Why? Because they were out there exposing themselves. That's why. And you can talk about health disparities, et cetera. But I believe all the studies are going to wind up saying, yes, when you were home with your doors locked, dealing with cabin fever, they were out there dealing with the coronavirus. And that's why they are more infected. Pay them what they deserve. I would say hazard pay, give them a 50% bonus, and I would do that now. Yes, airlines, also frontline workers. Also, we have a need and a responsibility to get the assistance we need to people in low-income communities. We have, NYCHA is public housing in the city of New York. We're going to set up a test program in NYCHA where we're going to have on-site health services and testing in the New York City area with New York City Housing Authority projects, working with local officials. We're doing it as a pilot program to see how it works. If it works well, we'll go further with it. We're also going to bring 500,000 cloth masks to NYCHA. That is one mask for every person who is in public housing, and hand sanitizer, et cetera, just so they have the necessary equipment they need to do the social distancing and protection. Personal opinion, not a fact. Throw it in the pail. What we're doing here, you know, as a general rule, what we do determines our future, right? As smart as government is, as smart as people are, that's how you shape your future. But this is cause and effect on steroids. What we do today will determine tomorrow. And we're not going to need to wait to read the history books. We make smart decisions, you will see smart outcomes in 2 weeks. We make bad decisions, you will see bad outcomes in 2 weeks. So when they say the future is in our hands, the future is really in our hands. And we're going to get through this. We can control the beast. The beast will not destroy us. We can control the beast. Great news. We have a lot of work to do to keep the beast under control. And we have a lot of work to do to reopen. But we're going to set the bar high and we're going to reimagine. And what we reopen will be better than what we had before. Build back better. Build back better. BBB. And that's what we're going to do. Because we are New York tough. And tough isn't just tough. Tough is smart. Tough is disciplined. Smart is united. And smart is loving.